A screening test for cervical cancer has high sensitivity, but relatively low specificity. What is the major advantage of using this test for population screening? A. Fewer false positive results. B. Higher positive predictive value. C. Fewer false negative results. D. Greater diagnostic accuracy. E. Higher specificity.
C. Fewer false negative results. Correct. A highly sensitive screening test detects most individuals who have the disease, making it less likely to miss true cases, few false negatives, which is why high sensitivity is preferred for population screening. A. Fewer false positive results, and E. Higher specificity are features of highly specific tests, not highly sensitive ones. B. Higher positive predictive value, PPV, depends mainly on disease prevalence and test specificity, while D. Greater diagnostic accuracy is influenced by both sensitivity and specificity and cannot be assumed from high sensitivity alone. A screening test for tuberculosis has a high specificity but only moderate sensitivity. What is the greatest advantage of this test? A. Fewer false negative results. B. Fewer false positive results. C. Higher disease prevalence. D. Higher incidence of disease. E. Increased sensitivity. Correct answer B. Fewer false positive results. A highly specific test correctly identifies people without the disease, resulting in fewer false positive results. Therefore, a positive result is more reliable for confirming disease. Fewer false negative results is a feature of highly sensitive tests. Higher disease prevalence and higher incidence are characteristics of the population and are unrelated to a test's specificity. Increased sensitivity is the opposite of the characteristic described in the question. A new diagnostic test correctly identifies 95 of 100 patients who truly have the disease, while missing 5 patients. Which measure of diagnostic accuracy does this represent? A. Specificity. B. Positive predictive value. C. Sensitivity. D. Negative predictive value. E. Accuracy. Correct answer. C. Sensitivity. Sensitivity is the ability of a test to correctly identify individuals who have the disease. True positives divided by true positives plus false negatives. A sensitivity of 95% means the test detects 95 out of every 100 diseased individuals. A. Specificity measures the ability to correctly identify disease-free individuals. B. Positive predictive value, PPV, is the probability that a person with a positive test truly has the disease. D. Negative predictive value, NPV, is the probability that a person with a negative test truly does not have the disease. E. Accuracy reflects the overall proportion of correctly classified individuals and depends on both sensitivity and specificity.